बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लिम व सल्लु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is a female patient with history of 3-month amenorrhea, 3 and 4 months, and now I am going to scan the pelvic region to evaluate the uterus. Here we can appreciate the pelvic region, and this we can see. Look here, this is the cervix, and this is the body and fundus of the uterus, and this mass is seen within the uterine or endometrial cavity. This mass is heterogeneous in texture because we can see multiple tiny anechoic spaces which are of different sizes, and in between the spaces there are echogenic dot line, and this mass is present within the uterine cavity, and this mass we can appreciate it is adherent, or we can say it is covering the whole wall of the uterine cavity all around. It is not attached to the one side of the uterine cavity, as we have seen in previous video clip. I have told you the Swiss cheese appearance, but here we can appreciate clearly it is present and adherent to all walls of the uterine cavity. So keeping in mind the history, 4-month or 3-month amenorrhea, and picture like this is called the cluster of grapes or snowstorm appearance, and this mass is present heterogeneous within the uterine cavity. This is likely the molar pregnancy. So what is the molar pregnancy? I have already told you that when the mother ovum is empty, means no DNA, no genome is present, and the sperm, 1 or 2 sperm, fertilize with the empty ovum. There is no fetus, no fetal poles, and this trophoblastic tissue that is present proliferate and gradually increases in size, and this tiny spaces which are nothing but the chorionic villi, which become filled with the fluid edematous and giving such tiny spaces. So as we can say that there is no, I am going to zoom it, okay, was to locate any fetal pole, but we can appreciate that it is all around the uterine cavity, and we cannot appreciate the fetal poles, and the picture is very much near to the snowstorm appearance sign and the cluster of grapes sign, and there are multiple innumerable spaces. We can see multiple tiny, larger, variable sizes. So this is likely the complete molar pregnancy. It is not partial, it is complete molar pregnancy. So means no maternal DNA is present, only the paternal DNA. Father DNA is present, maternal DNA is not present, so no genome, no fetus, only the proliferation of trophoblastic tissue. So when we put the color, we can appreciate such kind of vascularity which is present within the mass and also the in the periphery of the mass. And if we see so this is the flow. However, the velocity is not too much high. This is the uterine artery waveform. So the complication of this is that it may transform into the malignancy. So this should be referred to the gynecologist who will decide what to do, and also the beta SG level should be done in follow-up. So here we can appreciate this mass is all around. So this is the typical appearance of the complete molar pregnancy. Look here. So whenever we come across such picture and the amenorrhea is also present, and we can't appreciate any fetal poles or the yolk sac, so we can clearly diagnose this case as a complete molar pregnancy. When the invasive mole is also present, if there is an invasive mole, the velocity is very much high and there is a turbulent flow. Here velocity is not too much high and the turbulent flow is not present. So still patient is not having such a complication. Thank you very much.